Okay, so welcome everyone. This is a really important topic about how we prepare for getting COVID-19. And the reason I say that is because until a vaccine is developed, one of the strategies that the governments of the world are pursuing is to allow this virus to gradually infect the population at a low level and hopefully build up what they call herd immunity to a level that protects vulnerable people. And for that to work, people have to get infected with the virus. And that includes people with multiple sclerosis and other diseases. And so is there anything you can do if you do get infected with the virus to mitigate the risks of getting severe? So I'd just like to welcome my panel of experts on the panel. Jody, you would like to introduce yourself?
Yeah, hello, I'm Jody Barber. I'm a physiotherapist. I've been doing it for 30 years. I specialised in neurology 25 years ago. Have a caseload 100% of MS patients, and have developed a special interest in trying to promote respiratory health, particularly rehab, preventing difficulties, particularly as disease might progress, particularly for wheelchair users. So that's, I think, why I'm here today, because COVID's got a huge respiratory impact.
George?
Hi, yes, my name's George Pepper. I've lived with MS for 15 years. I'm one of the founders of Shift.ms and also the CEO. And, well, thank you for inviting me to be part of the panel. But I'm also here very much as an observer. I'm sharing the concerns that I'm sure many of you will have at this time.
Megan?
Hi, thank you for inviting me. So I'm Megan Roberts. I'm an MS nurse by background. I've worked in MS for most of my career, and I'm head of health professionals programs at the MS Trust. And
we have Sarah on as well. So Sarah is the chief exec of the MS Academy. Sarah, you want to say anything else? Anything else?
No, just thank you very much to the panel and for all of you joining us. Please use the Q&A function if you want to ask any questions during the session. We can't always answer all of them because of time restraints, but we will try and get through as many as we can.
Okay, so I'm going to just show a few slides as an introduction before we go into the question and answer session. I should have introduced myself. So I'm Gavin Giovannoni. I'm a neurologist based at Barts in London, and I do most of my time now is occupied with looking after and researching multiple sclerosis. So the term Preop or prehabilitation is probably being popularized by the surgical professions mostly. And what this really refers to is anything they can do prior to you having a major traumatic event like an operation, coronary artery bypass graft, so that when you come out of the other side, you do better than average. And so most pre-planned major surgery procedures now have a prehab program and have been shown to prevent or reduce poor outcomes. So for those of you who've been following the news, which I'm sure you can't not ignore because we just overloaded. Somebody was joking in my family the other night. We thought Brexit was a problem. COVID-19 makes Brexit look tiny. And they're probably right, because it just completely dominates the news channel and the news cycle. But if you've been following the news, it's quite clear that the risks of getting severe COVID-19 and dying from it go up with age. It's really most of the deaths are occurring in the aged population. Males also, about 60% of deaths are in males compared to female. There is something about ethnicity. Particularly when you look at the healthcare professionals that have been dying from it, a lot of them happen to be from Afro-Caribbean or African or Asian descent. There's also a clear signal. This actually emerged, particularly in the United States, social determinants of health. So poor people, lower down on the socioeconomic, are much higher risk of dying from it than as you go up the socioeconomic scale. And that seems to be a pattern that's panning out, and there's a whole lot of reasons, but it may relate to overcrowding, etc. And then mental health is also an issue. This probably is impossible to disentangle from the social determinants of health, and I'll put it in there. Then we've actually seen some early data emerge from the Italian database showing that people with higher disability and progressive MS are more susceptible to severe and COVID-19, and the deaths in the Italian cohort have been in people with more advanced disease. Now, it's very difficult to disentangle that from being older and having comorbidities. The next section is because they tend to go together. So it's usually older patients that are more disabled and older patients that have got more progressive disease. So it's quite difficult. There's also just a recent publication come out of Indonesia showing that people with lower vitamin D levels are more likely to get severe disease. Whether or not it's the other way around, in other words, severe disease causes low vitamin D levels, we don't know. I'll come back to that. And then there's been this theory that immunosuppression, being on drugs that lower your immune response, puts you at higher risk of getting COVID-19 and severe COVID-19. That looks like it's been turned on its head, actually. The data would suggest no. People with immunosuppression may actually be protected from getting severe COVID. So I put a question mark because we don't have, at the moment, enough evidence to either way. And then what is clear is people that have comorbidities, so other diseases in addition to MS, cardiac or hypertension, diabetes, people who have smokers, people who have poorly controlled asthma, other lung diseases, obesity is becoming an enormous risk factor, particularly in the United States. And deconditioning, just being unfit, has also been put forward as a risk factor. And so the question then is, can you modify any of these? So I've grayed out the ones I don't think you can really modify in the short term. And so we left with quite a large number of factors that we probably could modify. And we're going to spend the rest of the hour, I think, going through each of these modifiable risk factors: mental health, potentially disability. So what I'm saying is and what I'm trying to say to the MS community, because this is not a 3 or 4 month epidemic and it's going to come and go, it's here and it's going to stay here for months to years. I'm being serious, looking like it's going to be into 2021 and maybe beyond. So we can't just accept that your treatments are on hold and your assessments are on hold, because at some point in time, your MS center is going to have to work out how they treat your MS. So if you have active MS or you have symptomatic problems, you have to get them addressed at some point in time. So I know a lot of, I'm doing general medicine and we've got an enormous number of empty beds. And I work in the Royal London Hospital, which is one of the busiest hospitals in the country. And it's very rare for our hospital to have empty beds. And this the reason why we got empty beds is because the number of COVID-19 patients being admitted has really plummeted. And we've 3 of our medical beds wards have been converted from COVID hot beds to cold beds. And we're expecting people with other diseases to come in. They're not coming in. And so what's happening is the general community are ignoring other medical problems. And I suspect people with multiple sclerosis fall into the same category. They're having relapses, they're having bladder infections, they're having respiratory problems, swallowing problems. Rather than suffer in silence, let your MS teams know. And it's time to, put pressure on the NHS to change get the lockdown, at least in NHS, change so we can start seeing our patients again and managing them properly. And so the point I'm trying to make there is, if you've got active MS and you need your disease treated, I personally don't think you should be accepting not being treated for it in the next 6 months. You have to push for it, okay? You got to be proactive. Low vitamin D, I don't think we should spend much time on low vitamin D levels. The sources are sunshine, diet. Difficult to get it from diet because even fatty fish, which is the biggest source of vitamin D, are now quite low in vitamin D levels. And so the only real way of getting vitamin D levels up in the current environment is making sure you take supplements. Obviously, if you've got immunosuppression, there has been a government advice about isolation and shielding until the risk has passed. Now, the advice here is quite granular. It's not black or white. There is a grey zone. And I think you probably need to check with your local MS team if you're unsure, because some of the advice differs depending on where you live and who's looking after you. And then there's lots we can do about the comorbidity. So we'll spend some time discussing how we optimize and manage these treatments in the next few slides. So I've put this slide together just to explain to you about just to get the terminology right. So the SARS coronavirus, or CoV-2, is the actual name of the virus that causes COVID-19, which stands for coronavirus disease 2019. So this is the WHO definition of the disease. So you can actually get the virus and not have any symptoms. And it's looking like this is actually quite common. Even in the very elderly nursing home residents, about a quarter of them, from a recent publication in the United States, had the virus, detected it on swabs of the nose and the throat, and they never had any symptoms. And we think that that proportion goes up as you get younger. And so the current thinking is that even in the general population, about half of us, 50%, may get this virus, be infected with the virus, clear it without ever developing symptoms that get diagnosed as COVID-19. Then we get COVID-19, and I like to keep it simple: traffic light system, mild, moderate, and severe. And then there's a small number of people who have symptoms, and we think that's probably in the region of about 2% maybe who will die from it. And the death rate depends on how much is in the bottom of the denominator. So countries that are doing extremely high testing rates, like South Korea, Germany, the mortality rate is well below 1%. In countries like the UK, where we're not testing everybody yet, we're testing mainly people that come to hospitals, the death rate is higher because the denominator, which you put the ratio over, is just limited number of cases. So the death rate varies from country to country, and I think it's probably going to be similar across countries once we get the denominator in the ratio correct. Now, the current government advice is to, if you do develop COVID-19 symptoms, is not to come to hospital, not to see your GP face-to-face, but to manage yourself at home with self-isolation and wait for the symptoms to pass. The problem arises when you start going from mild to moderate and you start getting worse symptoms. What do you do? And the NHS has put in place this 111 service where you go through, and the problem with that is it can take quite a long time to get an operator if you're using the phone. And there's a web-based service that is also not ideal in terms of the advice it gives. And so a large number of people with moderate symptoms, these people are short of breath, persistent cough, maybe coughing up a bit of blood, are beginning to worry about their symptoms, about whether or not they need hospitalization. So if in doubt, please get a hold of a healthcare professional if in doubt. And then clearly the severe cases have to be hospitalized for observation. They tend to go into a general medical ward where they put on oxygen if they need it, and they have their oxygen saturations measured in their finger. And if the oxygen requirements go up, we may have to put them on these devices called Optiflow, which humidifies and controls the flow of oxygen. They may have to go into CPAP, which is continuous positive airway pressure to improve oxygenation. And some people have to be intubated and end up on a ventilator. And if they can't cope on a ventilator, we have this thing called ECMO, which is extracorporeal membrane oxygenation, where we start oxygenating the blood using an artificial lung. And there are very few of those in the country, and that's a very limited resource. But we are using it in some of our patients. So there is a gradation of treatments for this. And so once you hit a ventilator or need extracorporeal oxygenation, you have to go into intensive care unit. And the average stay in intensive care unit is, depending which hospital it's at, but it's probably in the region of 20 to 21 days. So you're in an intensive care unit for a prolonged period of time. What we're trying to do with prehabilitation is prevent death, but also move you down the spectrums, trying to prevent patients from getting severe disease. The other thing I want to just point out in the introduction is that it's quite clear now that we are flattening the curve. So rather than getting all our infections occurring in one small period of time, say a 3 to 4 month period, we're pushing down the peak and we're extending this tail. And this tail looks like it may extend for months to years. And most epidemiologists, these are people who research how diseases pan out in the community, are predicting that the tail is going to go out into late 2021. So we've got to have this pandemic or this epidemic in the UK with us for years. Hopefully, when a vaccine emerges, we can cut the tail off. But until a vaccine emerges, we're going to have to realize that people are going to get infected. And this is what this whole question and answer session is today, is to try and prepare you, people with multiple sclerosis, or the health care professionals looking after you, to getting the infection. I actually want to just promote something. I've let you know about this resource. I created this website called Multiple Sclerosis Selfie, MSSelfie, which is basically about self-management. And I've created a section on it about COVID-19, and I update it almost every day, sometimes every 2 or 3 days, with questions that are relevant. So if you do go onto the site, I've written a web page to cover these questions. I also update personalized questions. This is to try and help the MS teams that can't cope. As you're probably aware, a lot of MS teams have had their staff redeployed. I'm one, for example. I've taken out of neurology and MS, and I'm doing general medicine now. One of our nurses was redeployed, for example. And so your MS team is probably cut down to a bare minimum and just don't have time necessarily to pick up the phone or drop emails. So the idea of creating this question and answer session was to try and take pressure off them. In other words, if you read the question and answers in this thing, you usually find the question that you need answering, and you don't need to hassle your healthcare professional. And if the question isn't answered, I've got a little section on the site where you can actually ask the question, and I try and answer it in the next day or two. It just depends on how many questions come in my time. But at the moment, the questions have come down quite a lot. I was getting 50 plus a day, and we're getting now a trickle of 2 or 3 a day. So it looks like most of the issues that people have been dealt with. And I've even done a blog post, is there anything I can do to prepare for having COVID-19? And it covers some of these issues in more detail. And I'm going to have to update this because I did a blog post today, which I'll discuss later on in the question and answer session, that needs to go into this. So what you've got to realize is this is a rapidly changing situation, and things are moving literally sometimes on an hourly basis, definitely on a daily basis. So you really need to stay engaged to get the latest information, latest updates. The other thing I want to promote, the MS Society with the MS Register have created this national study where they want people with the disease to be on the register and report whether or not they have COVID-19. And the reason for doing that is we, as an MS community, need to know how people with multiple sclerosis do with COVID-19 compared to the general population, and whether being on a certain disease-modifying treatment puts you at risk of getting severe COVID-19. And also we'll ask questions about other factors like the comorbidities, the other diseases I've asked about as well in the questionnaire. So I urge you, if you haven't signed up to this, you must please sign up to this. It's really important for us to get it. Anyway, we're talking about rehabilitation here, okay? So Jody's already mentioned mental health. And so it looks like, at least in the United States data, mental health issues, this is particularly major mental health problems with severe depression, schizophrenia, etc., are higher risk. I don't know in MS population if being depressed or anxious puts you at higher risk, but in the general population, it looks like those are risk factors, probably because they link with social determinants, and because people who are depressed and anxious don't take medical advice seriously, or they ignore it. They tend to live in overcrowded environments, etc. So it is a risk factor for COVID-19. I'm not sure about the MS population now. So George, being a person with multiple sclerosis, what can you recommend for your fellow people with MS to do to manage their own mental health issues without seeing a healthcare professional necessarily?
Sure, no, it's a good question, and one that I think many people are asking right now. I think anxiety is a huge concern for all of us, and for people with MS. I think for many of us, it's anxiety kind of layered on top of anxiety. So it's more important now than ever that we have ways of managing that. I think it's okay and just completely normal to feel distressed at this moment. I mean, we probably haven't had this level of uncertainty for 80 years. So this is, there's big challenges going on right now. I think firstly, it's important that with all that in mind, that people are, they be kind to themselves. I personally finding that distraction is really important. just ways to just kind of stop the never-ending news cycle. So keeping up to date with the latest news is important, but not kind of being overloaded. I think having a daily routine is particularly helpful. And of course, looking after your body as well is very important. I'm sure Jody will talk about more of that later. I'd finally say that kind of staying connected is, as important as ever. And of course, living in isolation, that can make it tricky, but staying connected digitally is important. I think for people living alone, making sure there's ways to stay connected is very important indeed. And finally, in terms of resources, I find acceptance and commitment therapy very helpful, and some really good resources out there. I think Jody mentioned mindfulness earlier, so again, there's loads of resources available online. But yeah, I'd say acceptance and commitment therapy and mindfulness are two practices which I personally benefited from.
Jody, have you got anything you want to add to that?
No, I just think I was just picking up on what George said about being gentle on yourself. I think particularly with your approach to exercise, with increased kind of anxiety or a change in routine and trying to get back into exercise, it's managing those expectations as well. It's better to do a little bit of something than, because that's that, avoiding that boom and bust, which I think I've observed some people, just friends even, just caning it with their exercise because of their anxiety and stuff. So, just lower your expectations about what to do so that you've got some consistency.
So tell me, there's an exercise, but exercise seems to be a panacea for everything. You know what I mean? So, and I don't like exercise. This is what could you advise?
Funny enough, neither do I. No, it's I've got a passion for moving. It's interesting. Most people I see, it can be a bit of a dirty word, exercise, and I think it's top tips of what you can do to live well and reframing, what we call exercise. So it's finding something that you enjoy. I don't like to be too prescriptive. I think a degree of prescription can be helpful, particularly for some people, but there are a huge amount of resources out there that would encourage you to move, that would mean that you're taking a deep breath a little bit more, exercising certain muscles, and this just picking up what George said about being gentle on yourself. So, for example, a Zumba class, or there are lots of online resources for that. I personally enjoy tap dancing. I'm not recommending you take that up, but it doesn't have to be, dancing to music that you like, jiggling with your arms. It doesn't have to be an organized, prescribed form of movement. I think enjoyment is incredibly important. I don't know if that answers your question.
I could also recommend if people like just go for a walk and listen to a podcast or an audiobook while you're walking. So you're combining two activities. It's the listening to the podcast or the audiobook that gets you not thinking about the exercise, and walking is the exercise. But I think it's important that people realize that deconditioning is an important risk factor for a large amount of these comorbidities, and they should try and look at themselves and think how they're going to exercise. I'm going to move on to Megan now. Megan, there's some questions around the comorbidities here. This one individual said, I have hypertension, but I only get it checked twice a year. Do you think I should check my own blood pressure, self-monitor?
It's a good question. I think at the moment we're all having to take more responsibility for our own health, and I think the more that we can do to make sure that we're on track, and if know when we need to shout for help, the better. So yes, if you do have hypertension, and you'd usually go for regular checks, either that you do yourself at the BP monitor at your surgery or at the pharmacy. Obviously, you can't really do that at the moment. So it is worth doing at home. You can get digital monitors online fairly cheaply, sort of £15 upwards. You can get them all from your local pharmacy. They'll give you some advice and do those. If you're regularly tested at your GPs normally, you should have some sense of what your levels normally would be. But if you go onto the NHS website, there's a really useful bit. If you just type in onto search, understanding your blood pressure monitor, because it will come up with a page and you can just put in the figures that your monitor tells you, and it will give you a good indication of whether those are within the normal range, whether you should be notifying somebody that your levels are particularly high. So that can be a very useful backup as well. So it's no good just monitoring them and then not knowing what to do with the figures. You've got to have some idea of.
And the same thing for diabetes screening. Do you think people that have got risk factors or worry about it is there anything they can do to test themselves for diabetes?
Yeah, I mean, diabetes is the same sort of idea. So you obviously can't diagnose yourself with diabetes at home, but if you already have diabetes, it's really important that you make sure that your glucose levels are within the normal range for you, because that reduces the risk of complications from your diabetes and helps you keep generally sort of fit and well and healthy. So if you normally monitor, keep doing that. Do contact your health professionals, your specialist diabetes team or your GP, if your glucose levels are going out of sync. If you're worried that you might be developing diabetes, so that there's all sorts of symptoms you can look for, but the most common ones are if you're very thirsty all the time or needing to go to the loo all the time for wee. There are other symptoms like fatigue and things, but they're obviously a symptom of MS as well. So I would really think the key ones to be concerned about potentially are if you're finding that you're very thirsty all the time and that you're needing to wee a lot more than normal. Then do contact your GP and get some advice. But you can test yourself at home if you need to test yourself because you're on treatment. You'll already have a monitor. If you haven't got a monitor, then you can get hold of one again online, but it's probably not as crucial.
I mean, you can always. I think there are ways of accessing glucose monitors without seeing a GP. Via the pharmacist, for example. Purchase them.
Yeah.
So yes, I think it's important that if you do have diabetes or you think you may have diabetes, that you get it under control, and you get yourself screened and sorted out, because you don't want to get COVID-19 with uncontrolled diabetes. Okay, that'll put you at high risk of complications, or potentially at high risk of complications. Jody, back to you with the weight now. Somebody says, I've always struggled with my weight. What diet would you recommend I try during lockdown? Yeah. Is there anything you're going to give?
I don't know that I'm best qualified to give advice on particular diets, but I'm not going to answer that question directly. It's about having a balanced diet. I think it would be best. Yeah, I'm not going to answer that one directly because I don't advocate any particular diets, but having a balanced diet, because you still need protein, carbohydrates, and so that's a very bad answer to that question.
George, any comment about diets from your Shift.ms community? Was that too much of a hot potato?
I think it's really difficult right now. I'm hearing that, partly because people are moving less because a lot of people are confined to their homes. So there's kind of potentially less exercise, but also, I'm not sure if comfort eating is a technical term, but I think when people have anxiety, people have these kind of challenging times. Perhaps people are being less strict with their diets, so that's kind of the opposite of what perhaps I should be saying. But I think that's understandable. But in terms of kind of our advice is, a balanced diet is, I think that's where the evidence points. So people being just trying to follow a balanced diet as much as they can is helpful.
Yeah, so it's a very weighted term what a balanced diet is. I think what's pretty clear is processed and ultra processed foods, particularly carbohydrates, are no-no, and most diets now are trying to tell people to cut down on processed or ultra processed foods. I mean, the evidence that they're bad for you is unequivocal. So that then leaves you with what should you eat? So you should eat real food, and most people would recommend the Mediterranean diet for what it is. But one of the things I must point out is that certain diets are deficient in certain things. So if you are eating a plant-based, if you're vegetarian or vegan, you just need to make sure you're having enough zinc, because there is some evidence that zinc, people that are zinc deficient are more susceptible to severe infections, and some people will not be getting sufficient zinc from their diets. So then you check. If you're worried about it, take a supplement. A zinc supplement is relatively cheap, and there is a little bit of evidence out there that people that are zinc deficient get worse respiratory tract or other infections, for example. Maybe I should give this question to Megan. Megan, got any idea why people from Asian and Afro-Caribbean or African descent are more susceptible to severe disease?
No, is the honest answer. I don't. I'm afraid. No. I mean, I know it's obviously happening, but I'm not sure what the rationale behind why it's happening.
Yeah, so I'm not sure that's my personal opinion. If you are from a ethnic minority group and you have MS, I wouldn't spend too much time worrying about your ethnicity. There's nothing you can do about it. So what I'd worry about is all those other things you can do, like get yourself exercise and make sure you're screened and have all those other comorbidities looked out for. There was one on smoking. Who's done any work on smoking? Megan, have you done any work on smoking? Somebody was just saying that their smoking clinic had been closed down from their GP. Is there anything they could do remotely to help them stop smoking?
Yeah, absolutely. There's a lot of information and resources out there. The first place to try if you want to speak to somebody face-to-face is your pharmacist. They're obviously still open. You may be able to get some help there, and certainly they can recommend different products that might be able to help you stop smoking. But there's a lot of resources online. Again, if you look on the NHS have put together a very good website called 1U, and that's got advice on every aspect of sort of well-being, mental health, physical health, etc. And there's information about smoking on there. But I would start by setting a date for when you want to give up smoking. Tell people. If you don't tell people, then it probably won't happen. Make sure you tell people that you're going to do it. Find yourself a buddy or several buddies who you can talk to when you're having real cravings or really finding it desperate to, you've just got to distract yourself. The people that understand perhaps what you're going through and can talk you through it one craving at a time. That can be really helpful. I think thinking about why you want to give up, is it, I know my a relative gave up when he saw his daughter, young little toddler, pretending to smoke, and it horrified him, and that convinced him to give up. He didn't have any more cigarettes after that. So is it a family thing? Is it your own health? I mean, we know that smoking is probably the highest risk factor for serious illness with COVID. I think you've got, Gavin, in your information, it's like 14 times.
No, that came from the British NHS. This comes from the NHS data, from the ITU data. It's really. But I think this is one of the things is a lot of the times we recommend patients to go on to nicotine replacement therapies, and one of them is e-cigarettes and vaping. They may not reduce the risk of getting severe COVID, because it looks like air pollution, particularly particulate air pollution, is also an important risk factor. So anything that irritates the lungs, be it cigarettes or air pollution, and e-cigarettes may do that as well. So I'm not so sure, I don't know the answer to this, but I would say if you are going to use nicotine replacement therapy, maybe e-cigarettes or vaping is not the one to choose at this time. But it's very difficult to stop smoking. As we know, the success rate is low. And with in this time, it may be worth exploring with your GP. And GPs are seeing patients now using video conferencing, whatever, to get some nicotine replacement therapy prescribed to help you. Okay, so I'm going to jump ahead now because we spend so much time on comorbidities. George, what should people with multiple sclerosis think about in advance in case they need to be admitted to hospital with COVID-19?
Well, and there's some practicals that if they were diagnosed with COVID-19, then there's some practicalities of what they should be taking, such as packing a bag and thinking about that they'll be isolated. So ensuring that they can communicate with the outside world, ensuring they can stay occupied. So whether that's having reading material, whether that's having something to watch, having battery packs or chargers in a bag, and that would be very helpful. I think communicating with your family and friends in advance, making sure that you have daily contact with at least someone, I think would be very helpful indeed. I say that's kind of my starting points. But I also think people should, it's the numbers are terrifying that we're reading every day. But also we should realise that many of us will be okay, and so we should be prepared. and we should expect that if we do get COVID-19, that'll have an impact on our RMS. It's likely that beyond the actual symptoms we're hearing about in terms of high temperature and continuous coughs, that things such as fatigue is likely to kind of skyrocket. I'm hearing that from a number of people with MS who've had COVID-19. That has real implications on their fatigue, and also the time it takes to recover. That can take a number of weeks to feel back to how you were before. So there's some ways that some kind of views we've been hearing from our community, people who've unfortunately had COVID-19 and are kind of getting themselves back to normal.
Well, I think from the Chinese experience, those who have severe COVID-19 don't get better in weeks. It's it's quite destructive to the lungs, and they have to go to a rehab program. So it can be quite severe. So linked to this question, George, about preparing, there's a question that came in above this on the list, and I think maybe, Megan, if you could address this, is around the issue of this particular individual has quite severe MS. They're wheelchair bound, and they're worried about the triage system and not getting a ventilator. So what can they do to mitigate that situation prior to, at the moment?
I think the first thing to say is that, excuse me, at the moment, certainly capacity around ventilators is not too bad. So I think the situation that we were all dreading, where medics would be having to triage people based on the availability of ventilators rather than individual need, isn't happening at the moment. But you're right, it's important that people are prepared. And I think for all of us, whether we have MS or not, there's this is a really good opportunity to start to think about things like advanced care planning and getting those sort of affairs in order for end of life, should that happen, or when that eventually happens, hopefully a long time away for all of us. But in this particular case, there are two documents to bear in mind. So there's an advanced care directive or a living will. It's called different things in different parts of the country. And that's a legal document, but in that you can only list the sorts of treatment that you want to refuse. So if you didn't want to be ventilated, that's what you would need. If you do want to be ventilated and you want to make that really clear, then what you need is an advanced care statement. And that's a document where you set out the sort of care that you would want towards the end of life, or if you were seriously ill. And that is, healthcare professionals will do their best then to honour that and follow that. And that's also a really good guide for your next of kin and your loved ones to be able to advocate on your behalf. You can also appoint a power of attorney for health and welfare, and they can also then advocate on your behalf. And the idea is that you will communicate with them and talk to them beforehand about the sort of care that you want. If you're going to make any of those sort of statements, you need to let your health professionals know. It's no good having all these documents and your wishes carefully documented if nobody knows that they're there. So, send a copy to your GP, send them to your MS team, any of the health professionals that you deal with regularly, and make sure ask them to put them in your notes. Just to add as well to what George was saying about if you're going to go into hospital, getting prepared for that, I think a really good idea is to have a folder made and have any of these sort of documents put in that folder. So if you've got a living will, if you've got an advanced statement, have them in there. If you've got a health and welfare attorney, have their details in there as well. But also in there, I think lists of medications, any alert cards that you have, contact details for your health professional teams, etc. All that sort of information, and have it ready and accessible so that in an emergency, people know it's there and will grab it and take it with them, and then people know what your wishes are.
I'm looking at the four of you. Have any of you done this yourself? Jody, have you got a living will?
I've got a will. I haven't got an advanced care plan or anything, but I do know, moving the question away from me, of a client who was admitted, and he hadn't got round to writing an advanced care document about his wishes, which was he wished to be ventilated if need be, but he did give them my contact details, my team's contact details, so that we could discuss that with them at the time. So I think particularly if you wish to be ventilated, it's having that advanced care. I forget there's a plan, and there's the one that's the way you state your preferred wishes of active care that you would like, and list and name the healthcare professionals that know you, because my experience is they contacted us to discuss, so that active care can be considered depending on what's going on.
So just to say, the general practitioners have got a special quality metric for this, and so there's a special form on their electronic patient record where they fill this in on there. There's no reason why they can't do it via telephone or a video link. And so if you are concerned, I urge you all to contact your GPs and try and get this done in the next few weeks or months, because you really want to have this sorted out and don't want to do it when you are ill with the infection. That brings us on to the breathing exercises. There's this question about, I see many people are advising breathing exercises in case you get COVID-19 pneumonia. Is there something simple that you could advise them to do, Jody?
Yeah, so I've put some exercises on a YouTube channel that Sarah will be able to share afterwards. It's a 10-minute video because it's difficult to explain them quickly. But I'm going to talk through quickly now some two techniques which I think are really valuable generally for maintaining respiratory health across the broad spectrum if you have MS, and for anybody to do. It will increase your awareness of your respiratory system and the strength of your respiratory muscles. But there's one thing we need to remember here is that our lungs, our lung tissue they need to be stretched. We've got little sacs at the end called alveoli, and they need to be stretched because that stretch helps with the production of a fluid called surfactant, which keeps them open. And if they're not stretched, they won't stay as open. And obesity, lack of exercise, all of those don't help with them being stretched and staying open. So for those of us that can take a brisk walk, can run, can naturally get that natural stretch from exercise, you'll be getting it anyway. But it's still good to practice this exercise I'm going to go through now, which is called breath stacking. I'm just going to angle because I can't where you can't see. Oh yeah, you see me a little bit more. So breath stacking is where you take a breath in a series of in thirds to start off with. So I imagine it's a bit like you're filling a jug up with water, but the jug is too big to put under the tap, so you've got to fill it up with three separate jugs. So you're filling a vase up with a jug. So what you do is you take a breath in just up to your navel area, and then you hold your breath in. And then you take another breath on top of that to the nipple area, and then you hold, and then you take a breath in all the way up to the top. And that's helping to fully expand and get the breath into all areas of your lung tissue. So I'll give you a breath stack now. You can do it with me if you want. And if anyone practices yoga, it's also called a Viloma breath. So we're going to take... I'll demonstrate and I'll talk you all through it. So I'm going to demonstrate. You won't really see very much, but I'm going to take a breath in. And then I'm breathing out. So I did that in 3 stages, probably a little bit faster than we would do normally. I'm going to talk you all through it now, possibly a little bit slower. So you don't have to move your hands. If it helps you to move your hands, if that's comfortable to visualize filling up in thirds, you can do that. So make sure that you're comfortable, make sure you're sitting upright. So have a little wriggle. I need to wriggle. Anyway, so we're going to take a little breath in up to your navel, and then another breath in up to your nipple area. Keep holding your breath. Then another breath in just up, all the way up to the top, and then breathe out. Well done. Well done, panel. I don't know about everyone else. So that gives you an idea. There's a video I've done where I describe that in different ways so that you can get the gist of how to do it. You can do just up to 3 breaths. You can do up to 5 or 6. I know some people who are very practiced at this who can do up to 12 stacks, inhales, and then breathe out. But that obviously takes an awful lot of practice, and so I wouldn't expect you to do that. If 3 breaths is too much, just try and stack 1 on top of the other, and then build up to 3, and then maybe 5. The frequency is, all physiotherapists say 3 times a day. I just think we all know, we learn through repetition, and frequency will build in that you are at least doing it daily, so that you're building in learning that exercise, and then also building a bit of strength, and you really are stretching your lung tissue and strengthening your muscles for respiration. So that's breath stacking, but there is a video that can be shared afterwards that describes that in a bit more time, so you can practice with me. Another thing that I do teach people to do, recommend that you do, which is possibly considered less of an exercise, is singing. I'm not going to demonstrate singing to you. I've been well informed by my sons that I'm bad at singing, but singing is a really good breath exercise. So if you feel you can't get out, and singing at the top of your voice, and I've certainly worked with lots of clients who don't like singing pop songs or anything, but they love singing a football anthem at the top of their voice. So football anthems, rugby anthems. I found on YouTube there are some karaoke things that you can sing along to. Sing in the shower is a classic, obviously, or just put the music on really loud, sing along to it. That is a really, really good exercise. It's also really good endorphin release too, when you have a good sing song. So you have to release your inhibitions and sing. Another good exercise, and I need to, I've learned all of this, I've gathered all this experience from speech and language therapist from Queen Square, and also Rachel Moses, who's a consultant respiratory therapist who we've asked to help teach neurophysios over the years. So this is from speech and language therapy colleagues, is using a Kazoo. A Kazoo is a children's plastic toy that makes a little noise like that. It's a surprisingly good exercise tool. You can buy packets of them on Amazon. You can get metal ones as well. They will last a bit longer, but to practice, a little plastic packet will do. You need to hum down see, it's got, I don't know if you can see, it's got a thin end and a fat end, and you have to hum down the fat end of the Kazoo. On the video, it demonstrates how to hum. Believe it or not, a lot of people just blow down it, and you don't get the hum. I'm gonna hum Happy Birthday, because that will give you. Do you want me to do this?
Yes, go for it.
So, I wish you all had Kazoos, because it's a surprisingly good exercise for the diaphragm. And then if you try different types of tunes, it's then really exercising your diaphragm, and it is fun. Well, it's debatable. I'll give you a go. Here you go. So to hum, it's kind of more of a toot than a hum. It's kind of down it. So I'm going to do Happy Birthday. Are you ready? And that is surprisingly hard. And I've learned to do it without laughing. I've practiced it enough. So I've taught an awful lot of clients to do this with their carers. Initially, they think I'm mad, which is possibly true a little bit, but seriously, you can feel deep inside you something working, and that is your diaphragm. Alongside the breath stacking and using a Kazoo. So tunes like the Dam Busters, Over the Rainbow they take you through the full vocal range, and it's surprisingly hard for some people to get through the whole tune. So you can just practice just a little toot to start off with. Start with Happy Birthday, and then you can do whatever song you fancy. So that's using a Kazoo, but you do some people do blow, so it is worth practicing the humming, having a go.
Jody, where would I get a Kazoo?
On Amazon, you can get just put in Kazoo, and they sell these plastic little toy packets of them I usually sell them in bundles for about £8, or you can get metal ones for about £5. The plastic ones do collect spittle, and then they stop working. So I'd recommend a metal one if you really want to go for the Kazoo. But some people feel it's too silly to use, but I can't emphasize what a good exercise it is.
So I mean, maybe we can get some advice about working this into your daily routine, which will also help relieve the boredom of lockdown.
Yeah. So I mean, I really understand the earlier question about I hate exercise, because so working to daily routine is doing it before you go and do a routine activity that you have to do, like using the toilet, making yourself a drink before you eat. I don't recommend breathing exercises after eating. It's not as comfortable because your digestive contents are pushing up there. So recruit friends, family to join you. People are accepting of all different types of activities for well-being, to be fun. So you could use this as a time to form a Kazoo group. I don't know.
So this is another opportunity just to stress to the listeners on this. Life. We think that this lockdown is to protect. People beginning to think that this lockdown is to protect you from getting COVID-19. No, it's not. This lockdown is to flatten the curve and protect the NHS, to manage resources. It's not about protecting you as an individual. And the likelihood is you're going to get COVID-19. I'll be frank, I've accepted I'm going to get the infection. You just want to get it in an environment. So this particular topic today is critical to take seriously. You've got to assume that 4 out of 5 people in the UK are going to get this infection, and what can we do at a personal level to reduce the risk? So doing these exercises, particularly if you're more disabled and not exercising, is to do these. It may be the difference between going to hospital and staying home, going into intensive care or not going into intensive care, dying or surviving. And this is what we're trying to do, is activate you to rehabilitate yourselves and try and improve things. So thank you very, very much, Jody. That was very helpful. So most of the questions that are coming through, Sarah, are around DMTs again. So people are fixated with this DMT question, and we've addressed them over and over again, and they're on my microsite, they're on the MS Academy microsite. So I'm going to suggest referring people to those 2 sites to read answers to these questions, and to the MS Trust and the MS Society. And then what we will do is we'll do another one where we won't have any prepared questions. We'll just do this maybe in the next week or so after the ABN guidelines have been updated to address the disease-modifying therapy questions. George, is there any point I think I've missed? Because there are a few questions. How much time we got, Sarah? 5 minutes?
5 minutes.
George, is there any question you think we've missed in terms of having the disease yourself?
There's going to be a whole load of questions that come to me as soon as the call ends. I'm just personally, I'd just like to reiterate that this is a horrible time for all of us, and I suppose on the flip side, for many of us, we're going to be okay. So it's distressing, but it's better to be prepared. I can't say enough. Stay connected, keep active, and please be kind to yourself.
Yeah. Okay, thanks. There's one other question I think I should actually, because I did a blog post on using pulse oximeters at home to measure your oxygen saturation. So one of the problems is when you get a pneumonia or you get COVID-19, a critical factor to decide whether you get oxygen going to hospital is measuring how good your lungs are at putting oxygen into your blood. And you buy these little things that fit on your finger. I recommended that if you're living alone and you don't have anybody in your home and you get COVID-19 and you're sitting it out, sometimes you lose the ability to monitor yourself because, and there was a tragic case of a young surgical registrar who died from severe COVID-19 in Belfast, and he was living alone. self-isolating, and he obviously got sicker and sicker and then couldn't identify that he needed to go to hospital. And so I actually recommended that it's probably a good idea to get a pulse oximeter if you live alone and you've got nobody sharing your who can monitor you. It's just as a safety precaution, because so I'm not saying to people you need to go out and buy pulse oximeters. Saying that, though, all the clinicians I know, doctors I know who have had severe COVID-19, about half of them have actually monitored themselves with pulse oximeters, and the other half haven't. So it's not like the medics do this as well, but it's something you should just consider for safety factors. It's not an essential thing. It's just to have it at home. Jody, I don't know if you've got an opinion about self-monitoring with pulse oximeters. Yeah.
Was that to me, Jody?
Yes.
Yeah. Well, I think monitoring, just raised a thought that monitoring your baseline levels are good. And another good thing would be if anyone has a peak cough flow, to monitor your lung volume, just so that you can track. But if you haven't got that, but that's something we could look at producing video to advise people on, because they're really easy to get hold of. They're cheaper than pulse oximeters. Yeah. But yeah, I think anything that you've got access to that's going to monitor your respiratory health, but peak cough flows, it is cheaper than a pulse oximeter, I would imagine. Yeah, so I agree. Whatever you've got access to monitor yourself. Yeah.
Yes. So I'm just talking about I'm talking about that environment where you're told by the NHS, you're told by NICE to stay at home, self-isolate, and wait to get better. That's fine. But
yeah.
If you're getting worse, and there's nobody to look at you and say, "Oh God, you are getting worse," it's just dangerous. It's a dangerous environment.
Yeah.
At least if you've got some data you collected yourself, and you phone up 999 and say, "Look, my oxygen saturations have gone from the last 6 hours from 94 to 86. They'll come and fetch you."
Yeah.
If you don't have that data, they may say, "Well, you seem okay. I can talk to you. Phone me back in 6 hours' time." And in 6 hours' time, you may not be able to phone them back. That's an issue. Megan, you want to have any closing comments?
I think just to follow on from your discussion there, that I think the advice has been so much stay at home, and I think it's important that we take more responsibility, all of us, for our self-management, any health problems, our general health and well-being. But it is also important that we do recognise when we need some help, whether it's with COVID, whether it's with our MS, or whether it's something else that's going on, and make sure that we shout. People are still out there, are still wanting to help and support us if we need it. So, GPs are still there. You can get hold of them. NHS 111 if you can get through. MS teams are doing their best to be available. And I know that's very patchy around the country, depending on who's left in the team, who's been redeployed and who's not. Some teams seem to be operating almost at normal levels, albeit virtually, and other teams have just had to stop pretty much for the time being. Where you can't get hold of your MS team, contact MS Society, MS Trust, Shift, contact other people who know and give you advice, but don't struggle on alone. There is help and support out there even at the moment, would be my advice.
So I'd just like to thank you all. Thank you all for participating today. And I'm not saying we're ignoring the questions. We will answer these questions on the website, so don't go back to them. And then we will arrange a special question and answer session around disease-modifying treatments, another one, where the whole hour will be dedicated to answering these types of questions. Okay, stay healthy. Self-motivate yourselves and prehabilitate, so that if you do have to go to hospital with severe COVID-19, you come out the other side. That's the whole purpose of this session. Thank you very much.